I've recently had a few patients arrive at my clinic who suffer from ankylosing spondylitis. So today, I thought we'd clear up a few questions regarding this condition. Hi, I'm Dr. Alex and I'm a doctor of chiropractic. So, what is ankylosing spondylitis? Ankylosing spondylitis is a chronic inflammatory condition that primarily affects the spine. It causes inflammation of the vertebrae or the bones which make up our spine and can lead to pain, stiffness and eventually fusion of the spine. So to understand the effects of this fusing, we first need to take a look at what the healthy spine should look like. So in the healthy spine we should have 3 curves, one in the neck, mid-back and low back, as you can see. There is also plenty of room for the nerves to pass out from the intervertebral foramen. As ankylosing spondylitis worsens, new bone forms as part of the body's attempt to heal. The new bone gradually bridges the gaps between vertebrae and eventually fuses sections of vertebrae together. Fused vertebrae can flatten the natural curves of the spine, which causes an inflexible, hunched posture. When we look at an X-ray, we can see this quite clearly, and this is referred to as a bamboo spine. Beyond the spine, it can also impact other joints and even organs. Early symptoms of ankylosing spondylitis may include stiffness or pain in the low back and hips, especially in the mornings after periods of inactivity. Neck pain and fatigue are also common. Over time, the symptoms might worsen, improve, or stop at irregular intervals. The areas most commonly affected are the joint between the base of the spine and pelvis, the vertebrae in the lower back, the places where tendons and ligaments attach to bones, mainly in the spine, but sometimes along the back of the heel, the cartilage between the breastbone or sternum and the ribs, the hip and shoulder joints. Ankylosing spondylitis doesn't have any specific cause, even though some genetic factors have been seen. In particular, people who have a gene called HLA-B27 are at greatly increased risk of developing ankylosing spondylitis. The condition also seems to affect men more than women, and the symptoms usually appear between the age of 15 and 45 years. While there is no known cure for ankylosing spondylitis, there are certain things you can do yourself to help alleviate the symptoms. Firstly, you can seek out a professional healthcare giver such as a chiropractor or physiotherapist who with physical methods such as spinal manipulation, massage, can improve your spinal flexibility. Medicine can also be used to reduce pain and inflammation such as painkillers, but be sure to consult with a medical doctor first. Surgery is typically not recommended for people with ankylosing spondylitis. Another very important aspect of managing and living with ankylosing spondylitis is self-exercising and stretching, which can provide a number of benefits from pain relief to improved strength and flexibility. So what we're going to do now is we're going to go over a few very basic exercises that you can do yourself to help improve and maintain flexibility of your spine. So for the first one, what we're going to do is start off lying face up, and then what we want to do, because obviously all the bones are starting to fuse together, so we just want to improve. So what we're going to do is just very gently do a pelvic tilt. So from this position, try to roll your hips backwards as much as possible, and just continue with that motion. You should feel a little bit of a stretch. So that's the first one. Repeat for about 30 seconds. And then what we do after that is very gently from this position, so keep your knees bent, and slowly, as much as your spine or your mobility allows you, gently roll over from side to side. Again, very gently, just as much as it allows. Then what we do is 30 seconds each leg, grab and pull up. Obviously my pants are a little bit tight here, but pull up and feel a stretch of the lower back. Hold for about 30 seconds. And then repeat with the second leg. For the fourth one, what we do is, I've covered this very similar in another exercise, but from Mackenzie. So from this position, get up on your elbows. Try to create as much extension in the low back as possible. Hold for about 30 seconds. Try to push up as much as possible. Good. And for the fifth and final one, is we do the cat and mouse exercise. So from here, this position, push up with your mid back as much as possible, and then down. Push up and down. Try and get as much flexibility and mobility in the mid back and the low back here. And repeat for 30 seconds. So try to do these exercises once per day at least, maybe in the morning when you wake up. But obviously the more you do it, the better. Try to do these stretches every day because they will help alleviate your stiffness and improve your flexibility. And if you can do that, then trust me, your spine will thank you for it.